Hi, my name's Logan. I'm going to be your student nurse today. Can I have a report on your patient?
Sure. Shanana O'Connor, room 231. She's 34 years old, female, weighs 177 pounds. She's allergic to trimethoprim sulfamethoxazole. She breaks out in a rash if she's exposed to it. She's a full code, admitted by Dr. Engelbert. Her primary diagnosis is fever of an unknown origin. Patient has diabetes mellitus type 1 and an end-stage renal disease. She's presented today to the ER at 5:30 with fever, chills, and general malaise. The patient reports elevated blood glucose readings and decreased appetite for the past few days and minimal urine output for the last month. The patient has history of renal failure secondary to diabetic neuropathy and hypertensive nephrocirrhosis. Left forearm AV graft surgically created 11 months ago with no complications. She has been undergoing scheduled hemodialysis 3 times per week for about 1 year. Listed for a transplant 6 months ago, the doctors ordered IV imipenem-cilastatin to begin immediately after dialysis. Her last set of vital signs were 100.9 for temperature, blood pressure was 138/78, heart rate was 108, respirations were 20, O2 sat was 97 on room air. Her last blood glucose level was 210 at 5:45. Her skin is warm and intact. She has a mild diaphoresis. There's no lesions noted. There's a functioning AV graft. It appears clean, pink, and intact. Brewy and thrilled present. Nail beds are pink. Capillary refill less than 4 seconds. Patient alert and oriented. Pain level is at 4. There's numbness and tingling in lower legs. She's tachycardic. She has regular rhythm, S1, S2. She has a slight 1+ non-pitting edema in the lower extremities. And femoral pulses are 2+ bilaterally and 1+ pedal pulses in both feet. The capillary refill is less than 3 seconds. The chest expansion is symmetrical. Bowel sounds are present in all 4 quads. The abdomen is soft, round, and non-tender, and there's no visible masses. She's been admitted to the medical surgical unit. She's been ordered urine and blood cultures to rule out bacteremia or urinary tract infection, and she's on IV antibiotic therapy.
Okay, why specifically is this client receiving this medication?
This client is receiving this medication to combat any sort of infection she may have that is causing her to have the fever. Until we can rule out what infection it is, this is a broad spectrum antibiotic that will work to kill several types of bacteria.
Okay, what action does the medication have on the body?
In the body, imipenem binds to the cell wall and causes cell death for the bacteria. Cilastatin prevents the breakdown of both drugs in the kidneys.
Okay. When should you question administering this medication?
I would question administering this medication if the patient's creatinine clearance is less than 70, or if the patient has had reactions with penicillin or cephalosporins in the past. She does have renal failure, so we want to monitor her kidney function tests closely.
Okay. Does this medication have a therapeutic serum level?
No, but we usually, after the first dose, we usually measure for the peak in the plasma level 30 minutes after the dose, and we measure the trough for 30 minutes before the next dose.
Okay. Which vital signs must be monitored?
So all vital signs are important, but we want to keep an eye on the client's temperature to see if her fever is coming down.
Okay, which physiological parameters should be monitored when the medication is being administered?
We want to monitor the client's overall appearance because an adverse effect seizures. We also want to monitor the clients for signs of anaphylactic reaction like a rash, laryngeal edema, or wheezing.
Okay, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So in the hospital, it's important to teach the client about the IV patency and what signs to look for if it becomes infiltrated, it becomes red, or it would feel like pain. And so I would also encourage the client to let me know if she feels uncomfortable or if she is irritated around the site. I would also teach her about the potential side and adverse effects of the medication.
Okay, and what interventions must be taught for taking the medication safely at home?
Since this is an IV piggyback medication, she will most likely not take it at home. She would probably take a different form of it, but I'll teach her the same, I would enforce the same teaching about the side effects and the adverse reactions.
Okay, what are the side effects and adverse reactions?
So the side effects include nausea, vomiting, diarrhea, or rash, and adverse reactions can be C. diff, seizures, and anaphylactic reaction.
Okay. How will you know the medication is effective?
We will know the medication is effective when her fever is gone down and her cultures come back negative.
Okay, that's all the questions.
Okay, well, about to administer meds.
Okay.
Alright, so walking into the client's room. Hi. I'm Naz. I'm gonna be your nurse today. How are you feeling?
Okay.
Okay, can you give me your name and date of birth?
Shannon O'Connor, 34.
And do you have any allergies?
Yes, I'm allergic to trimethoprim sulfamethoxazole.
Okay, I'm just gonna double check that in the chart.
I had to go to
Go ahead and open
and
the patient's chart.
I was hoping that you would just go back and have the sodium chloride.
Okay,
and then just
so
take the green
Shannon
dot if it's
O'Connor
seasonal.
and allergies are trimethoprim sulfamethoxazole. Okay. So you have an order for IV sodium chloride and antibiotic imipenem for your fever. So, do you know the side effects and adverse reactions of imipenem?
But no,
Do you know the side effects?
no.
Okay, so you might experience rash, nausea, vomiting, diarrhea. Adverse reactions can be seizures or anaphylactic reaction or C. diff. So if you experience any of these things, you should let me know as soon as possible, okay?
Okay.
Alright, okay. So I wash my hands for any procedure and put on gloves. Yeah, this one's working. Alright, so first thing I'm gonna do is I'm gonna check the doctor's orders and pull out the medication and compare it to the MAR. Okay. Alright, so we have sodium chloride and we have imipenem, cystatin, and they're those two right now. Okay, so we're gonna start with the sodium chloride back over here. So I'm gonna check if there's any leakage from the bag, check the clarity and the expiration date, which is March 18, 2018, so that's good. And compare it against the MAR. Sodium chloride. Continuous. Okay. So first step for medication administration is identifying that you have the right patient. So if you can give me your name and age.
Shannon O'Connor, 34.
Okay, do you have any
Okay, and what are your allergies?
Trimethoprim,
Mark,
sulfamethoxazole.
you are 8 years old,
Okay.
no known allergies.
And double check the medication. So it's 500 milliliters, it's continuous, 30 milliliters an hour.
Yeah, I can do that.
It's due right now, and it's going to be through the IV port. So I'm just gonna
Even Jolly. She came in today with
sorry,
a non-healing
Harry.
ulcer, CH3. That occurred about 6 months ago from hospitalization. She's been treated at an outpatient clinic for the past 3 months. She is going to be NPO after the night tonight for a surgical debridement tomorrow, ordered by the doctor. She has a past medical history of dehydration and anemia. As we did a assessment on her, she's A&O times 4. She had a complaint of dry skin. She
so first thing you would do is you would clamp it, which is already clamped.
She has hard of hearing, 20/40 vision,
And then
reactive to light accommodation.
you want to
Cranial nerves 2 to 12 are
spike the bag.
motor and sensory exam of her upper extremities are normal. She's her glucose
Put this here just so it won't touch the
with the use
floor.
of walkers. She's a non-smoker. She's cleared occupation, chest expansion, symmetric. She is a sinus rhythm with occasional premature heats. Pulses on all extremities at 2 plus. Cap refill is less than 3. Her ECG and X-ray are pending. She is soft, her abdomen is soft, non-distended, non-tender, without sounds times 4. She is brown stool. She verbalizes decreased appetite with
Oh, this is hard.
she is currently on a regular diet. With her urinalysis, her came back clear.
Can I get your help?
She complains of stress incontinence occasionally. She had lost
I
pap
open
smear
it.
10 years ago. Her wound is, like I said, was our sacrum. It's 4 centimeters by 4 centimeters
Pretty
by
tough.
1 centimeter. She also has the IV in her right dorsal metacarpal 22 gauge. Her labs are fairly normal except for a decrease in albumin and an increase in white blood cells.
Thank you. That was
Her vital signs
pretty sealed in there. Alright, so both ends are supposed to be sterile. So I'm gonna just carefully put it in there.
She didn't get an AccuCheck, but her glucose and her labs determined that she is at 101.
Fill out half of it.
Yeah, why is the client
Okay.
receiving this med and what actions does it have to block?
Alright, can you read me
Tested positive for E. coli.
your identification number? My scanner isn't working.
Is that
84
has a bactericidal effect by
2,
inhibiting,
3,
protein
Uh-huh.
synthesis
3,
that
4,
disrupt the cell membrane.
3,
What should you
6,
question giving
6,
this
0.
med?
You want to question this med,
Okay.
if she has renal
And I'm
impairment,
just gonna,
and what she does
Fill
have
out
here,
the medication barcode
neuromuscular disease.
manually.
So with her
I
hearing
have it
impairment, we'll
here.
monitor her very closely. It's also contraindicated if she's hypersensitive. Hypersensitive because then she goes into shock.
Is there a therapeutic serum level?
Her therapeutic serum was 4 to 60 micrograms per milliliter. The dosages will be adjusted if she's having renal toxicity.
Which vitals? Physiological parameters?
Okay, so we have the green
You
light.
want to keep a close eye on the respirations and temperature because it could determine
We have the
if,
green light.
infection's getting worse. Or
That means we have the right patient, the right medication.
anaphylactic shock, and you also want to monitor
And
her, sputum, urine, stool.
again, so the medication is sodium chloride, and it's at 30 milliliters an hour. It's gonna be an IV in her right hand, and it's continuous. The time
You don't have
is
to worry too much about that. But here in
Monday
the
at
hospital,
21,
make sure
so
she'll stand
right
signs and
about
symptoms
now.
of phlebitis and possible anaphylactic shock and other adverse effects that could occur.
What are the
Okay.
adverse effects?
The adverse effects would
I'm gonna prime
consist of
the two now.
Okay, renal
I'm gonna
toxicity,
loosely
hearing
open up
toxicity, vertigo, ataxia,
cap
and allergic reaction.
and let it drip for a little bit to eliminate all air bubbles.
we'll know if it's effective if the patient themselves even feel that they are feeling better. The wound could possibly be healing better, and also, but for sure the white blood cell count would go back into a normal range. Good. Alright. So, let me go ahead and do this.
Okay, so now the tube is primed. So we clamp it back again. And since we don't have the pump, we're just gonna connect it to the Doppler.
So first I'm gonna go ahead and
Okay. So I'm just gonna.
alright, actually I gotta disconnect this IV first. The bag is empty. So I'm gonna go ahead.
So I'm gonna swipe this. Alcohol swab. And
That I would throw away into just in case.
then I'm just gonna connect it to the Doppler flow and tighten it. And then I'm also gonna prime it again with the Doppler on it. So I would just push it to prime or open. And I would prime it. And then I would alcohol swipe this and cover it.
There's no resistance flushing, and I would put this into the biohazard.
And then I'm gonna assess the IV site real quick. So there's no redness.
Put in,
Is it hurt?
No.
Type in
Okay.
patient ID, medication.
I'm just gonna
pharm
flush
note,
it.
And I have the green light.
I'm just gonna wipe this and flush it just to make sure it's patent.
That'll be my first check. And I also just want to make sure that the
Okay.
primary
Did it hurt?
is
No.
Okay.
clear, the expiration
Alright,
date
so
has reactivate
now we can
2020. So it's good, clear, the looks like it's no tamper.
we can
with the,
connect these to each other.
the bag.
Again, we always swipe,
I'm gonna go ahead.
so you never know how many bacteria are living on there. And we connect it. And we adjust the flow rate. So the order is 30 an hour. So I'm just gonna keep twisting it till it's at 30. And watch 5 trips. So I'm just gonna document the time and then the site,
And I want
which
to
is
double
the
check.
right
for,
hand, and the dose, and the
So
flow
the
rate.
right patient, which is
Okay.
Martillon.
Alright, so now for the second
sodium
medication,
chloride, potassium,
which is
and,
imipenem.
the right time, which is 15:14, but you guys do a 1600.
So I'm
I can
gonna
do the
grab
power
that.
beforehand. Right route, which is IV.
And
the,
also check it
right
for any
dose, which is
leakage.
1000 milliliters.
The expiration date is good. March 19, 27, 2019. So that's good, and it's clear. So I'm just gonna compare it to the Mars. So it's imipenem.
Make sure there's no air bubbles.
500 milligrams,
Um,
100 milliliters over 1 hour. So the flow rate is going to be 100 milliliters, and it's due right 2100, so right now. And it's IV piggyback. And I did double check with the pharmacy guide to make sure that these both can be given together via IV piggyback. So now I'm just going to prepare my secondary tubing. So first thing, again, we clamp it. So it's clamped in this case.
That way,
Alright, so
we won't know until our top would. Alright, so now that that's in place, I'm gonna go
make
ahead
sure
and
these 2 areas are
document
sterile.
that the site is in the right.
You connect them carefully to
Also, metacarpal.
each other. And Let it fill halfway.
Time is 15.
Alright.
15.
And I'm gonna need your
So signs and symptoms.
I'm gonna
of
need to do the patient identification again, so
colitis,
I'm gonna need your name, your first and last, and your age.
IV.
Shannon O'Connor,
Shout out.
34, and I'm allergic to trimethoprim.
Okay. Alright, so double checking the chart. Shannon O'Connor, 34. Allergies, trimethoprim, so that's good. Then I'm just gonna, can you give me your ID number?
Yes, it is 842-3343-660.
Okay. And I'm just gonna scan in my medication again.
Okay, I have the green light for the gentamicin.
Okay, so we have the green light again. That means we have the right patient, right medication. And the site is gonna be going
Now
the
I'm
same.
gonna go ahead
So it's gonna be the right hand,
and lower
and it's gonna be it's gonna be 100 milliliters an hour, and it's a 500 milliliter bag, and the time is 2100, and the frequency is gonna be continuous.
While I'm doing this, I'm gonna check for right
And so-
patient, right feeling, right medication, gentamicin,
So,
right time. Is it 15,
What I'm gonna do
16,
here
and,
is I'm going
right dosage,
to
I'll be going over 8
lower
hours with the
this bag
primary, which will make it 63
since I want
drops an hour,
my
or 60,
antibiotic to
63 drops a
infuse in
minute, sorry.
first,
and
and I'm gonna be
yeah, and then right now it'll
connecting
be,
the antibiotic to the first port right here. So after I cleanse it, this one's already capped, so it's sterile. Just connect them to each other. Okay. And then what I'm gonna do is I'm gonna prime it, do the backflow style. So I'm gonna hang this up,
okay, go ahead.
and I'm gonna hang this lower, and I'm gonna open this. So now the medication is going to this one. This way we ensure we're not losing any of the IV antibiotic. Alright, so we hang this again and adjust the flow rate.
You wanna
So
go ahead and reverse
this one is
time?
going to be 100 milliliters an hour. So I'm just gonna go up to 100 and watch it 5 drips.
Alright.
Make sure the clamp is open, which it is. And that's it. So how are you feeling?
I feel okay.
Now I'm gonna set the
Is there anything I can get you right now?
dial flow
No.
Can you tell me the side effects and the adverse reactions that I've taught you earlier?
Nausea, fatigue, vomiting, rash, anaphylactic shock.
Good. So if you feel anything abnormal, or if you experience any of those signs, just press the call light and I'll be there in a second, okay?
Thank you.
Yep, no problem. So I'm gonna take off the gloves, wash my hands, finish documentation. So we're gonna put the dose, the time, and the route given, and then initials and save it. Alright, and there's no assessment that I'm going to be documenting for now.
Okay, I just have a couple more questions for you.
Sure, go ahead.
initial
Were there any pertinent pieces of information you referred before administering the client the medication?
Yes, I reviewed first I identified my client, made sure it's the right one, and then checked if she has any allergies to penicillin, cephalosporins, which she doesn't. I made sure that it's right to administer the medication, and it was the right patient, the right route, and the right dose as doctor's orders.
Did this information affect your decision to administer the medication?
Yes, because if she was allergic to penicillin or cephalosporins, then I would have contacted the doctor and told him to infer her to different medication.
Did this information affect how you administered the medication?
No, because I followed the doctor's orders for the route, and I double checked for the dose appropriate, and made sure that the client didn't have any confusion or wasn't experiencing any abnormal signs of like nausea, diarrhea, or vomiting, or any of that.
Okay, thank you. That's all my questions.
Yep, no problem.
Alright, well, if you